Hi, my name is Cindy Fire, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, May 6th, and this is my daily briefing. We haven't had any changes in our numbers. We've still only had a total of 41 cases today in Missoula. 39 of those were identified by testing, and 2 were epi-linked. We've had 40 recoveries and 1 death, and we currently have no active cases. The state has had a total of 456 cases and has had 16 deaths. First, I just want to announce that we are hiring here at the Missoula City County Health Department for registered nurses to work at our testing clinic and at our call center. These positions are Missoula County short-term hires at 20 to 40 hours per week. New nursing graduates are welcome to apply. If you're interested in applying, please contact our logistics chief, Pam Morfitt, at pmorfitt, that's MORFITT, at missoulacounty.us. I want to talk a little bit about antibody testing. We're still getting questions about antibody testing, and while we hope that there will be a reliable test soon that can tell us who has had the virus and who is immune, an FDA-approved test is still not available. There are over 150 tests that have been developed and about 10 that have an emergency use authorization from the FDA, but none of them have full approval. There are several reasons for some concerns with these tests. One, the accuracy of the test is paramount. If the test can't tell the difference between the antibodies from other coronaviruses and COVID-19, then you could be getting a false positive. False positives would mean that there are people who would believe that they had COVID-19 and are protected, but are actually not immune. Changing behavior based on a false positive can really be dangerous, as it puts you at risk of developing the disease. Second, we don't know how to properly interpret a positive result from COVID-19 antibody test. While it seems logical that the presence of antibodies means that the person was exposed and has developed some immunity, that may not actually be the case here. So again, a positive result may be misleading. Even if the test is accurate, a positive test might not mean that someone is protected from infection, and changing behavior could still be dangerous. Third, they cannot be used as a sole basis to diagnose active infections. These tests cannot be used to determine the number of cases that we have in our community. There are clinics that offer the antibody test, and you are welcome to get one. However, we just want you to know that it may not give you the result or the information that you seek. You need to be really careful in interpreting the results, and don't change your behavior thinking that your test result reflects your risk of getting sick. We just still need to wait for more research to come out on that before we can say for sure, yes, this test is accurate, and that means that you are now immune to the virus. Next, I want to talk about face coverings. Now that more businesses are opening, please consider how you can help keep the spread low and help these businesses and employees. Businesses need to have social distancing measures in place per the governor and local orders, but when shopping in retail stores, grocery stores, or going to a pharmacy, please follow the health board's strong recommendation about wearing cloth face coverings. If we can keep pre-symptomatic spread low, we can keep our numbers down. We can keep that curve flattened. So let's not see the cases return as more of us start moving around and interacting, and do what we can to continue to minimize the spread in our community. So we've had no new cases in 2 weeks and almost a week with no active cases. We are still on schedule to review local orders on Friday, and if there are changes, we will let you know that at the end of this week. So again, for those of you looking at when gyms, theaters, pools, museums are opening, those establishments are closed under the governor's orders, and we have no control over when he is going to actually open those establishments. But we will be reviewing our local health officer orders and announcing any changes at the end of this week. So that's it for my daily briefing for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr, that's CINDYFARR. Click that notification bell so you get notified whenever an additional video is uploaded. Please follow us on Facebook at the Missoula City County Health Department Facebook page. We post lots of really useful information there. If you're looking for guidance, or you're a business owner, or you are a restaurant or bar or casino that want to know how you can reopen your business safely, please check out our website at missoula.co/cvirus. We've got all of our guidance documents posted there. Also, we've got general information and frequently asked questions posted on that website, so you can check that out. And if you would like to schedule a test, if you're having any symptoms at all, even if it's mild symptoms, and would like to get a free test done, please call 258-INFO. That's 406-258-4636, so that you can get a test scheduled through our drive-through testing facility out at the fairgrounds, or you can call that number if you just have general questions about COVID-19. So I will talk to you all again tomorrow, and stay healthy.